as you're not on me.
Coming to you from the heart of the Pacific, brought to you by Paulie by Design.
Respected at all times.
Broadcasting from San Francisco, California, the city by the bay.
It's about to go down.
We shine on positive Pacific Islander role model every Sunday.
Party on a Sunday.
From 10 a.m. to noon, it's time for the iconic Faika podcast with your hosts,
Listening to
Nackie and Carl.
Good morning, everybody. Today's Sunday, of course, May 31st, Season 4, Episode 19 of the Faika podcast. I'm half of the host team. Carl, with me, your lovely host, Nackie. Good morning, Nackie.
Good morning.
And today, of course, there's no way we're not talking about what is going on across the nation. Tens of cities protesting. So we'll definitely dig into that. We're going to, in the second hour, talk to Dr. Samoa from the City of Hope about COVID-19 and some other issues. And that's in the second hour. In the first hour, we are just going to talk, chop it up. Nackie, what's good?
Good morning. So I just wanted to say happy Sunday and good morning to Sandra Ma'ea. Good morning, Sandra. Eddie Unatoa. And Evelyn Fooley. Good morning, Mom.
Good morning, Auntie.
So Thursday, well, every day this week, at 6 a.m. we have a prayer group with First Lady Audrey Tufuli and Pastor Maverick. They have a prayer group at 6 a.m. It's a Zoom prayer group. And so I've been on that. And then you joined us one day. And it's at 6 a.m. But it's a really good, you just go in and they pray. Or if you want to pray. So, okay, here's how it goes. You go into the Zoom group. And then someone or First Lady Audrey will sing a song. And then they pick three people, or not even three people. They leave the mics open for everyone. And then they ask three people to just jump in whenever. And someone says a prayer about being thankful. Another one is needs, and then blessings, I believe it is. And so, and it's really good. I've really enjoyed being in the prayer group. You start your day off with a prayer. I mean, I already pray in the morning, but this adds to, I don't know, it feels good when we get out. So
It feels good to do it in a group.
It feels good to do it in a group. And First Lady Audrey does a really good job of she has a really good voice, by the way. And so, yeah, there's like 16 to sometimes there's 18 to 20 people in the room. So if you would like to join our prayer group, hit me up and I'll send you the Zoom link. And it's really fat. You don't even have to say anything at all if you don't want to. The majority of the time I get in and I just say good morning and then my mic goes off and then I just listen. And so, and then this morning, Pastor Lau was on, Pastor Lau Asa'au, and he gave some words and scriptures, and then my mom said a part of it, and and then it goes on. But you really don't have to say anything. You could just come on and listen and get your word for the day and then leave. And then after that, we take it a little further because my mom knows that we're taking Samoan language class with Tama Fatleava. So she has like Bible class with us. So everyone always says, if you want to learn how to speak Samoan, you have to read the Samoan Bible. So that's what we've been doing in the morning. My mom will pick a chapter and then we'll read the whole chapter. We'll read the Samoan part and then the English part so that we understand what we're reading. And so I thought I'd be like, oh God, but I'm really enjoying it. And so then after that, after I spend like an hour with Bible class, and in our Bible class is my mom, me, Sister Flo, and Nellie. And so in the beginning of the week, we were like pronouncing the words like, oh, like going really slow. And then today we were just like speeding up the words and actually pronouncing them correctly. So that was good. And I'm actually starting to understand. And it is true. If you want to learn how to speak Samoan, you have to read the Bible. I don't know why, but it seems to work. And so we've been doing that. And then Thursday, we both were at the Samoan language class with Samoa, and is facilitated by Professor Lassie Loyan. And so then we broke into groups, and which was on Zoom. We broke into groups, which was kind of cool. So we got to learn how to do that.
That's a really good aspect of the class. I liked being in the groups, in small groups, and then you put your sentences together, and then you came back into the big group and spoke the sentences.
Right.
You were in a class full of ringers. We only had one ringer in my group. Thank goodness we had somebody in there to keep us in line. But you had ringers all the way across the board, including yourself.
Yeah. I get into class, and I was like, oh, Flo, let's get into the same group. I didn't know that they pick it for you randomly. And so they had, I was in class with the teacher. We broke into groups, and I was in the group with Samoa. And so, but I was like, oh my gosh, I can't say, but I learned so much that day.
He's a
Good
great
morning,
teacher.
Gloria.
Good morning, Gloria.
Good morning, Gloria. Oh, I will send you the link. And so I get into class, and it's Tama, and it's our homework from last week was ole. So you have to say, and ole pengi, this is a pen, or this is a fruit. And we learned, so we had to say, fruit. We had to pick a fruit, a job, and blah blah blah. But it was really
building,
a building,
a relative, and an animal.
Right. Good morning, Natasha Pomele. Good morning,
Natasha.
John Maneafainga. Good morning, Roland Evans. John Maneafainga. Good morning from Las Vegas. Good morning, Las Vegas.
We're in the city, a couple hours.
Linda, Sister Linda Young. Good morning. And Yvette. Hi, Yvette. Yvette Manamea. I haven't seen her for a minute. I'm kind of missing laughing.
I miss my Monomea Strong folks.
Monomea Strong folks. So yeah, we had the prayer group, the Samoan language class, and then and so I've been doing a lot of PBD stuff all week because I'm going back to work tomorrow. Tomorrow will be my first day back to work. I know, boo, but I'm kind of looking forward to it, so I get to talk to other adults.
We'll talk to you in a week and see if you're still looking forward to it.
I know. I go back to work tomorrow, so I've got to drive to the city. So I'm hoping there's not that much traffic, but I doubt it. Valerie and good morning.
Good morning, Valerie.
Dr. Samoa, good morning. We'll be talking to you in a little bit. Dr. Samoa. We'll be talking to Dr. Samoa this morning. If you did not see him on C-SPAN, go check out our page because we just clipped just his part, and it's kind of awesome that he testified.
Yeah, I think hopefully
that's freaking badass.
We understand as a community how lucky we are to have
Yes.
someone like Dr. Samoa speaking for us in front of Congress, in front of the most powerful committee in Congress. We're very lucky to have him.
Yeah. So I can't wait to talk to him because I've got lots of questions, and there's a lot. And then we have a lot of free testing, COVID-19 testing places that are that are all over the Bay Area. So we'll bring up a few. Brian Cassidy. Good morning, Brian.
Morning, Brian.
So yeah, I'm all over the internet all week, and then I was doing a lot of PBD stuff. We had a million Zoom meetings, like a million. And then I'm like kind of semi-hooked on Foodie for the Booty. It's a page where you go on there and watch people eat or they cook something. And my cousins have been on there, Cindy and Cece, and they've been eating like some really, like they had crab boil last night. I just happened to go on sneak peek for a little bit. And they were like, it looks so good. Like some of the food I see people, you need to send me samples and I'll just send me food. That's all. Send me food. Send me food. PJ, good morning, PJ. Oh, congratulations,
Yeah,
PJ.
congratulations, PJ.
PJ graduated. We're so proud of him, and he's headed off to San Francisco State. And so we're so proud of him and the whole class of 2020. And so yesterday I cooked dinner. So I love Thai curry. Thai coconut curry, not the regular curry. I don't know what you call it because I don't want to get in trouble, but I love Thai coconut curry. So there's this Thai restaurant that we go to that I order Thai curry, and it's so expensive, but it's so good. And then all my kids were here yesterday, and so there was 9 of us, and so like I didn't have that much money, okay? But I figured it's cheaper to make it than to order it. So I Googled the recipe and I went to the store, bought all the ingredients, and then I made a big old pot, which I'd like to add that it's all gone this morning. I thought I would have seconds.
That's how you know it's good.
Oh my God.
If you had a whole bunch left, it wouldn't
so
be any good.
It was so good. So hit me up if you want the recipe. If you like Thai curry, I will give it to you. It was so simple and so quick to make. And I had like 2 or 3 bowls, and so did everybody else in the family. So it was really, 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 really good. Yes, PJ, I don't know if you want the recipe or you just going to buy it. Good morning, Larry Duenas. Larry Duenas. Good morning, brother. So yeah, foodie for the booty, and you can pick up some recipes. Neo is always on there cooking and eating something. And
if I could cook as good as Neo, I'd weigh 300 pounds because he can cook anything.
God,
Like
he
everything
can
he
cook.
makes and he puts
Yes.
up there looks amazing.
He made empanadas. For yesterday. Yesterday was Utopia San Francisco's raffle, their bingo raffle, and someone won $1,000 from Cedric's bingo page. So someone won $1,000, and it's 500 and 200 and 150. So it was really, really, really good, and I'm glad that I got to. I didn't win, but I'm glad people won, and they were so excited. And
Glad to support, and it was nice
Right.
to see they actually had extra prizes. They had advertised, I think, 5 prizes or something, and then they ended up giving away bonus prizes after. So they actually gave away more than they advertised they were going to give away.
That's awesome. So PJ says, I think I like it because of the coconut milk they use in it. It's so good. I know. That is good morning, Monica. Texas.
Good morning.
Tammy. Good morning, Tammy's checking in from Oregon. If I can
As
ask you
always.
guys to share the podcast, because we'll have Dr. Samoa on in the second hour, and we'll be talking about COVID. We'll be talking about Carl has some questions about some stuff about George
related to George Floyd.
Related to George
Yeah.
Floyd that maybe Dr. Samoa can answer for us. And so, yeah, Jeff Lupe, good morning.
Morning, Jeff.
So, yeah, I love Thai curry. And so that was me. And then, the craziness that's going on in the world. But before we get to that, how was your week, Carl?
My week was, one day I had 11 virtual meetings. I think the day after that I had 9. It was a crazy week because it was the first week back from vacation. Watching the country, we'll talk about that. Well, the last 2 nights, seeing what's going on across the country has really been riveting, and again, we'll talk about it after, but that was a big part of my week. Friday at the prayer group, I joined, and I see why. I always heard, the same thing that you were saying, that if you want to learn Samoan, a good way to do it is to get involved with the church. So song, listening to the speaking, all those kind of things, I could see came into play. So I am definitely going to make sure that I get up earlier and participate in that. But that's big. And I think it's a good time right now to check in on everybody's spirituality, because there's so many crazy things going on.
So many crazy
You got
stuff.
COVID-19. I mean,
Right.
2020 has been a crazy time. And we have these
Crazy.
topics as we go through the show. But first day back from vacation, a ton of work crammed into 4 days. Originally, I thought, hey, do the week vacation and pin it onto a 3-day weekend.
Right.
So I had all week last week off and then Monday off of this week.
Awesome.
what that meant was then I crammed all that work into 4 days. And that's probably not something, I don't think I'm going to do that again. But vacation was good. Did a lot of relaxing, just kicking back, doing PBD. Let's see. This week, Samoan language class. Again, big shout out to Tama for having the classes, first of all. But second, finding ways to be engaging, be funny, and find a way to do it virtually. Because I was kind of have sat through class with him live and in person.
Yes,
I was kind of wondering how it was going to flow, because it was so powerful, and educational in person. But the classes, virtually I'm learning a ton the same way that I was in person. So. It's available. You don't have to drive all the way into San Francisco. There's people that are in Antioch and Sacramento and all over the place that are participating. I really hope that I'm in Sakio's class, where I break out in groups with him, because he was keeping us in line when we were trying to make our sentences. It's good to have somebody there that speaks it.
It's good to have one person in each group, keep everyone in check. Like we had Tama and Fanga, actually.
Right. Two teachers, two people that teach it.
Yes, we had Tama and Fanga. So it's a really good class if you're interested in learning. And people are checking in from all over the place. There's, Seattle, and another girl is from, I think she's calling in from Tonga. And so it's a really interesting class. Phyllis Faaswamalie, Tayamanuia. Who else is on here? I don't want to miss anybody. I'm sorry. Pep Malipai. Good morning, Pep.
Good morning.
Congratulations to his graduate. There's lots and lots of graduate. So I'm watching on Facebook and I see a lot of, parade graduations where you drive by the house and with balloons, or you drop off a gift, or just drive by and blow your horn like crazy to wish people a happy graduation because you can't gather or nothing's open for you to celebrate. And so congratulations again to the class of 2020. I feel bad for them because they work so hard and they deserve to walk across that stage and they deserve to celebrate with their family. And so, hopefully when this is all done, everyone there'll be like 50 million barbecues, 50 million barbecues with people standing 6 feet apart. Maybe not.
Yeah.
So that was our week. Is just the crazy.
So before we jump into the craziness that's going across the country, I want to say happy birthday to my mom.
Oh, happy birthday,
she's
Auntie.
82.
Oh my
today.
Gosh.
She's socially distanced, stuck away in Fort Bragg, unable to, really get out and do things. And she's a pretty active person. So
yay.
I wanted to say happy birthday. I love you, Mom.
Happy birthday, Auntie Dot. I'm so 82, huh?
82.
And she plays Scrabble.
She's the family champion at Scrabble.
Right.
She's one of those grandparents that does not let the family, the kids, the grandkids win. So It was a huge day in my daughter's life when I think she was 16 or 17, the first time she beat Grandma at Scrabble.
No. Now you know where Carl gets all his words, and he's super good at all that.
My mom's a wordsmith. It's easy for me to remember how old she is because she's the triplets age plus 60. So the triplets will be 22 in December. That means she's 82 now.
Awesome. Yes. Happy birthday, Auntie Dot. Good morning to Cree Mawia.
Cree, winner of one of the Utopia.
She won one of the raffles. If you didn't know, sister, you won money from Utopia San Francisco. Go hunt down Neil. I'm sure he's looking for you. Commissioner Faunga Molinga. Good morning, Commissioner.
Faunga.
So lots of testing sites going up. I don't know if we want to talk about it now or...
Now it's a good time.
Yeah, Mena, you want to pop that COVID flyer up?
So one of the things that as we progress along the line with COVID-19 is going to be finding out if you're safe around your family, you may have it and not know it. You may have already had it. You may have antibodies, all those kind of things. You're not going to know until you get tested.
Right. And so they have free, and I say free, people, COVID-19 testing today in the Bayview area from 9 a.m. to 5 p.m. at Leola Havard School. Is that how you say it? Havard? I thought I misspelled it, and I thought I wrote it down wrong, but it's Leola Havard School. It's at 1520 Oakdale Avenue in San Francisco. It's from 9 a.m. to 5 p.m. today. And then Monday and Tuesday, the Sunnydale Viz Valley area, they'll be at Hertz Playground, which is 1701 Visitation Avenue in San Francisco. And they're there from 9 a.m. to 7 p.m. So you have all day. And if you work tomorrow like me and get off at 5 o'clock, you can go after work because they're there until 7 p.m.
So that's 3 days. Today,
Yes.
tomorrow, and Tuesday.
And then they have some, they're setting up for June 6th and 7th for unsheltered and homeless initiative, but those will be determined later. And I think we'll let you know. Of course, we'll post all over the place. But I'm grateful for the free testing that's going on. And let me see who's sponsoring this. Is any United Health Organization. So thank you for that. That's awesome. And then who else? Congratulations to Patsy Tito, who also graduated from school. I seen that SCDC has been, Samoan Community Development Center in San Francisco, has been driving to graduates' homes and delivering, a basket of stuff and just.
And the seniors.
And the seniors. Oh, yes. They've been taking seniors' gift packages. I think, is it every week? Every week,
I believe so.
I believe they've been giving their seniors a box with essentials every week. So if you're needing essentials, go on to, and you don't even have to be Samoan. You just go Samoan Community Development Center. They have a light application there with a few questions just so they know what you need, and they will try to help you. If you're not from San Francisco Bay Area, they will get you connected to resources or try to help you some way. So big shout out to Samoan Community Development Center for all the great work that they are doing. Patsy and John Aisha Afoa are doing a great job there, their whole staff. And they go check out their TikTok page.
All their social media.
Yeah, all their social media. They're up and running. They're doing a great job with that. So I thought that was awesome. Also, Samoan Solutions is out there helping with the testing too. So there's other testing areas, San Mateo Civic Center. There's Ceremony High School and East Palo Alto at the YMCA. And I will repost those. Those guys are doing a great job. Gaynor, Siatonga, Melissa Raynald Jones, who had a great event this month for Pacific Islander Heritage Month. They had the Voices of Oceania Music Festival thingy-majiggy. They had one last night with Us Rex, who is a comedian, entertainer. And then, I forgot the other girl. I'm sorry. But they were talking Census 2020 and how important it is for us to fill out the census.
Yeah, the census counts, we've talked about this for months now at this point, and we're really progressing along that timeline. So if you haven't done that, understand that it determines how the government redraws our districts, which can give our communities appropriate representation in Congress, the state capitol, and cities and towns across the country. So an undercount means underfunding. That's what you need to understand. If we don't get everybody counted, we're not going to get the same funding. Mm-hmm. We could lose congressional seats. And really a complete count can gain your community accurate representation. So,
yeah.
It's 9 easy questions. It's online. It's easy to do. And if you haven't done it already, make sure that you do it. If you have done it already, speak to your family and friends and make sure that they do.
Right. So Census 2020, you have until October 14th to fill out your census. 9 simple questions. And we just need to be counted. It's the our hashtag Count Us In. On Wednesday, we interviewed Tua Kealoha, who is an actor, a producer, a writer, director, a community activist. And he started off in, really rough start in life with gangs and just all kinds of trouble. And then he followed his heart and his passion and started writing. He has a movie and a series on Amazon Prime, Samoan Gold, and then his movie that premiered award-winning film, Dear Lord. So we spoke to Tua Kealoha about his amazing career, and we touched a little bit on the murder of George Floyd.
It's a really good it's a good conversation. If you get a chance to check it out on our Facebook page, it's a really good conversation about where you're from doesn't necessarily define where you're going.
Right.
And he made that decision at a certain point in his life.
Right.
He talks about that, and he talks about the changes that he made.
Right.
And it's really inspiring talk for how you change your life and how you change where you're headed.
Exactly. Yeah, I loved watching his story. We interviewed him, and we also went to Salt Lake City, Utah, to see him film or do the last scene of Dear Lord. So it was really interesting, and we're grateful for the time that he gave us. So thank you, Tua, and God bless your journey. Also, you can see the interview on our Facebook page, or you can go to our YouTube channel where we're starting to load all our interviews. Give me a minute. I'm starting to load our interviews, and then we're working on, before we started our own spot or whatever. We were at FCC Free Radio, which is in the city, and we had a bunch of shows that we did there, and I'm starting to edit those because we
Nackie
can't
has
play the
learned
songs.
how to edit.
Right.
And look
yes.
out, she's not letting me edit anything. She's keeping everything here.
Well, Carl taught me how to edit our podcasts, and so I've had to edit out some of the songs because they're copyrighted, and so I had to take out all the songs so that I can upload our podcast. And so if you missed some of our show, or actually our season 1, 2, and 3, stay tuned. I'll upload those onto our Faika app. So go ahead and download or upload our Faika app to listen to all the previous shows.
So talk about that for a second. Did you ever think that you were going to learn sound waves and compression and editing and appending audio files? Did you ever think that you would learn that?
Hell to the no.
So there's an example of finding what your passion is and then learning things that you never thought you would learn in order to make your passion work.
Exactly.
So to make Poly by Design or the Faika podcast work, Nackie, I didn't know it either. Neither one of us knew anything about audio files. We didn't know anything about editing or sound clips or sound waves or any of those kind of things. We're both doing it now because it supports our passion.
Right.
So there are things that you probably would never imagine yourself doing. When you find your passion, when you find what you really want to do, it doesn't matter what you need to learn or what obstacles out there, you find a way to get around it.
Yeah.
So great job learning how to do it, but at some point I need to take that back over.
Yeah, you could have it. Let me just catch us up. So Edward Feliciano, good morning. Thank you for tuning in. Sister Cree, good morning. Let's see. Mary Vevel, good morning, Mary. We miss you. Where you been, girl? Where you been?
She's been out on Lake
She's
Merced.
been out, yes. D. Nua, good morning. Imani.
Aloha.
Hawaii checking in. Imani, good morning. So
it's Nana Cooley, I think.
Nana
is where he's
Cooley.
from.
If we can ask you to share the podcast, because we'll have Dr. Raynald Samoa in the second hour, and we have, if you have questions, go ahead and post them here on our Facebook page, and then we can ask him. But most of it, I think we're just going to be talking about the Pacific Islanders and how the numbers for Pacific Islanders and COVID-19 have skyrocketed. Even though, like we're in California, it's slowly starting to open up, but Pacific Islander numbers are slowly still going up. So we're going to discuss that and see how or where we can do Mary Mac. Mary Mac. So there you go. Mary Mac. That's Mary Vevea. We don't know where she's been because we've had Pacifica Talanoa. Mm-hmm. You want to talk about Pacifica Talanoa?
Pacifica Talanoa is essentially a virtual support group where members of the community get together and we talk about anything and everything that has come up that week. And usually it's not confined to the week. We end up talking about whatever topic comes up. We end up on tangents. We end up talking about, I don't know, The Rock, Jason Momoa. We end up talking
My
about
baby daddy.
all kinds of different stuff. All 5 of Nackie's baby daddy. So, and it's just kind of it's a stress release. We have people that literally, the last few weeks we've had people on the phone with driving safely. I'll say that, but headed home from work or headed somewhere. Right. And we're in the car, in their ear. They say things, they check in, or they just listen.
Yeah.
And it's I would say it's a much more, before we were all meeting in San Francisco. Yeah. The support group was more of a face-to-face thing. And now there's people in Washington, there's people in Las Vegas, there's people all over the place that are checking in. So it is every Friday from 6 to 8. And if you get in at 7, that's okay. And we had somebody log in, I think, at 7:50, 10 minutes before we ended. And she still got to say what she needed to say and hear what she needed to hear before she went. So I think you are, at this point, messaging Nackie at Poly by Design to get the Zoom link. And because of all the Zoom hacks, we are needing you to go through Nackie so that we can control where that goes.
Yeah. I also, online right now is Melissa Ray Nathania Jones, who is with Peninsula Conflict Resolution Center, and they had a Zoom meeting this week that was really good. Manufo Liainga Anawai was one of the panelists. Leafa was on. She was also one of the panelists. Alici, I mean, just
Tulua and Jacob Fitisemanu, right? Was he the other
powerful, crazy people, like powerful people. It was a coffee and conversation series via Zoom. And of course, Jake Fitisemanu Jr., who is he's in Utah, and he also is a part of the National PI COVID Resource Task Group that we're all in. But it was a great meeting, a Zoom meeting. Melissa Natana Jones and her partner as well, Michelle, and it was really good. And so if you missed it, they have another one, I believe, June 4th. So go to the Peninsula Conflict Resolution Center Facebook page and catch all their upcoming activities. They did a really great job. And of course, we were all crying because Manufo was talking
so passionate.
Yeah, she's so passionate.
Passionate and powerful. I actually logged on late because I had jumped from one Zoom to the next Zoom, and I came into that one late. And I came in midway through Manufo speaking, and about 30 seconds after I was in, I was choked up listening to her speak and following her passion. And that's a powerful woman. So if you are able to join those calls, that's a good group to listen to. Coffee and Conversation, is that what it's called?
Yes, Coffee and Conversation. And if you missed it, go to their Facebook page and you can watch it because it was Facebook Live and they keep it up on their page. So go check it out. They do a great job there. We're going to go. So
we're going to take our first break. Don't go anywhere. This is our first song. It's Morning Ride by Fiji. You're listening to the Faika podcast. We will be back shortly.
We're back. You're listening to the Faika podcast. I am Nackie, and with me as always is Carl.
Good morning.
That was one of our favorite songs, kind of, sort of. That was Fiji Morning Ride. There you go. Carl,
Yes.
you want to talk? Fool! You want to talk about what? You want to talk about the craziness that was going on?
I mean, I really think that this could be a defining time in our country's narrative. And I think that's what needs to come out of this. There needs to be big change as a result of this. Because it's kind of that strike while the iron's hot. So the narrative is out there now. And there's a bunch of good things going on. There's a bunch of bad things going on. But in the end of it, the topic is now. It's out here right now. We got to talk about it right now. So change has to happen because of where we have, and they've still got a trial to go with the cop. You still have all those things going on. But there was 25 plus cities last night with protesters, black, white, brown, Asian. It wasn't all looting, so that's not a narrative that needs to be. It doesn't have to be one or the other. It's more than one thing. There were protesters out there, there were rioters out there, and there was looters out there. And one's narrative doesn't destroy the other. And so it's frustrating for me to see the outrage of the looting, and then it's like, well, that just takes away everything from everything else, and that's not the case. What did you think when you saw? I would say, because this is like the fourth or fifth night.
Yeah.
Did you think it was going to get to where that it's gotten?
I didn't think it was going to get this crazy. Real quick, I just wanted to shout out Brittany Afu, who's our sister in Utah.
Morning, Britt.
And Puka, who's in Florida. Good morning. I didn't think it was going to get this crazy. And it's not really, I didn't think it was going to get this bad, but I understand why, it's gotten to this height of I don't know, craziness. It's not really crazy. It's just, I totally understand why everyone is so angry. I totally understand that. Another police officer killing a black man, man of color. And it's because we're people of color, this totally affects us too. It affects, and I'm always worried about my kids because when you look at them, my kids are minorities. And so I worry when they leave the house. I worry when my son is driving and he gets pulled over that he acts correct. You know what I mean? Like my son has to act a certain way in order for him to live if he gets stopped by a police officer. So I'm not surprised. Because I've been seeing all the, I've been going through the messages and the internet, and I'm not surprised, but I just, I don't know. I don't want it to become normal, for us to, you know what I mean? So that it doesn't make any sense. And it's just, I seen where somebody, who is that blonde crazy lady who's on the news all the time? She said, what's her name? What? Tommy. Oh, Tommy something, the blonde haired lady.
Oh, Laren.
I seen where she had wrote, what is looting and all this? How is this going to help your cause or something like that? And somebody replied to her, we tried
protesting this way
and quietly, and you still, nobody cared then. It's like, what is it?
But what she said, so if you think about what Tommy Lawrence said, she says, how's it going to help your cause? It's not our cause. It's your cause too.
Right.
Until people understand this is our cause, it's America's cause, it's society's cause. Mm-hmm. When people say your cause, that's the problem right there. Right. Like, everybody should be outraged. That's a human being. And if you care about human beings, then that should outrage you. And if you care about, uplifting people to be on even, on par and on level
Yes.
with everybody else, just her post of the help your cause, that shouldn't be, that's the problem.
Right.
Is that it's our cause. And
Right.
there's been I've seen a lot of discussion about, Black Lives Matter and
Right.
Polynesians support Black Lives Matter.
Mm-hmm.
It wasn't very long ago, and we're talking maybe a month, maybe two at the most, where there was an Afakasi Samoan 14-year-old boy in Rancho Cordova that was abused by the police,
Right.
an abuse of force.
Jaja.
So, right. And when you think about where rights, and where the movement comes from, all minorities ride on the backs of African Americans. When they
Right.
move the step forward, when they move the narrative forward, and when they improve rights and standards for Black people, we all go with them. We
Right.
all get improved. All of our standards and all of
Right.
our ways of life get improved with them. So,
Right.
absolutely, all minorities should support. Should support the movement of rights and the way that the Blacks are moving things forward. But it's not a time to separate things and be one group versus the other. That's why I'm saying now is such an important time, that change can be made now because the attention is there.
Right.
People that are trying to say it's all looting or it's all rioting or any of that kind of thing is trying to avoid discussing the actual narrative, where there was a young man who was wrongfully arrested. He was beaten. He was taken into a New York jail. He was sodomized with a broomstick. He needed surgeries, multiple surgeries to correct it. They tried to cover it up. All these kind of things. And this isn't, you would think that's the 1940s or the 1950s. This was 1997, 1 year before my triplets were born. This is modern times. When you look at Ahmaud Arbery, and hey, I'll tell you what, there's two people right now that are happy all this is happening. It's Greg and Travis McMichael, because they were squarely in the public eye before George Floyd got murdered. But then you have, Ahmaud Arbery, and now you've got George Floyd. Like, these are not isolated incidents where you can say it's one person. It's a system. The system was trying to cover it up. So, my question is, how do we take advantage of this and make positive outcomes? Because the outcomes and the change needs to be big. It can't be, this is incremental where there's small discussion and we all move on and life's normal. So those are, kind of my thoughts on it. I was happy to see when I saw protesters in Colorado that were mainly white out there protesting, holding signs, doing that. I'm proud of that. I'm proud to see that it's not all minorities out there protesting. And there was I saw a map that had, I think, 21 cities on it that were protesting last night. And I know it's not correct because Sacramento wasn't on it, and there were multiple protests in Sacramento. So, if 21 is not the right number, and I know just at first glance, 2 seconds in, that there's not a complete list of the cities there, probably 30, maybe 40 cities out there.
Right.
9 different states had the National Guard mobilized. Now's the time. If we're going to make change, now's the time. And it's not time to be divided over, PI rights or Black rights or those kind of things. It's human rights, and we could make steps forward if it's done right.
Yeah, it's crazy, and I still haven't watched the video in its entirety because I've seen bits and pieces, and I've heard people tell me about the video, and I don't want to watch it. I'm sure I will watch it at some point, but right now I can't get myself to watch it because I don't want to do that to myself. I don't want to see him dying in front of these 4 police officers who are supposed to protect and serve, and they did not do that day. So, and
I guess
also
they worked in a club together. They worked at a nightclub together.
who?
Chauvin, the cop. that had his knee on his neck.
Oh, I read that too.
Worked.
No.
He was an off-duty officer at a club. No, menacing. What's that?
Who just moved there? George Floyd.
Yeah, from Texas.
Yeah.
But he moved into, I think, 2014. I think in the owner of a nightclub has said that they worked together at the nightclub. That George was George Floyd was a bouncer on the inside of the club, and Chauvin was a off-duty officer outside of the club. So whether they interacted at the club is unknown. But the owner is saying that they worked together at the club.
Yeah, that, I don't know. It's so crazy to me that this is going on at this time, and that, people continue to die in the hands of police officers. And not all police officers are bad, because of course I work in police services, and there are way more good cops than there are bad cops. It's just the bad cops get caught on TV or on camera.
Like, I wanted to be a cop. I wanted to be a cop when I was in high school. I went to college to be a cop. I did internships with SAC PD. At the end of it, I didn't want to be a cop because of what I saw. I had interactions with cops, and I worked enough with them that I just wanted to do something else. In my 3-decade career in retail, I've worked with law enforcement organizations shoulder to shoulder. I mean, all the way to the point to being there when we're serving warrants, or they're serving warrants, and we're there as the retail sector. Doing surveillances with cops. My softball team that I played on for 10 years was all either loss prevention or cops. Mm-hmm. So when I've been on personal levels or professional levels with cops, don't mind it. Like, had great relationships and friends.
Right.
When I'm not around them that way, I avoid police at all costs because of interactions that I've had that have been negative. And I've had this discussion with people, and they're like, "Ed, what do you mean at all costs? Like, if there's a bunch of them on that side of the street and I'm on my walk, I will switch sides of the street and walk across on the other side. I don't want to have interaction with them unless I absolutely have to." And the question's been, well, are all your interactions with police bad? No, I've had lots of interactions with police that have been extremely positive. I've, not got pulled over for speeding and not got a ticket, and had friendly conversation with cops. But the problem with that is it only takes one bad cop to permanently give you a record, to get arrested, to end up in jail for the night, or end up dead. It only takes one bad cop. And I don't know which ones I'm dealing with. They don't have a sign on them that says I'm a good cop and I'm a bad cop.
Right.
So in my mind, because they can mess with my liberty and my freedom and possibly my life, I just avoid them when I can, because I don't know who's who. The other narrative that I think needs to come out is the term good cop and bad cop. Mm-hmm. If there's a cop that's clearly breaking the law and there's 3 other cops standing there not stopping him, I don't think those are good cops. I think they're all 4 bad. And if they write a report
definitely all
to support what's happened, and they lie in the report to support the bad behavior, now, you know what I mean? You don't differentiate the one cop that does something bad to the ones that stood around and watched. Those are all bad, especially if they're writing it. And that's one of the things that really makes me mad is the reports get written a certain way, and because you're a cop, that gets believed. If you get to court, it carries more weight than the citizen who's saying it didn't go down that way.
Yeah, I did. Out of all the bad videos and the places that are on fire and everything, I have been watching some really good that has been coming out of it. I've watched a couple of police officers going to go, patrol a protest, and it's a white officer and a black protester, and they're having a civil conversation, and the black gentleman is trying to talk to another black gentleman who is yelling behind him saying, "Don't talk to the cops," and da-da-da-da. And he's saying, he didn't kill George Floyd. Let's try to, he's trying to be the middle person, but at the end, they all hugged each other. And, I've been seeing those kind of videos. I've actually been searching them out because I'm tired of seeing I'm not tired. I don't want to, I can't take any more mental,
Right.
like it so hurts my heart. It could stress you out,
It is stressful. I'm watching a lot of it, but I'm trying to see like how are we going to come out of this and what's going to be done. There are a lot of positive images out there that don't get shown. What I did notice like yesterday, and I really was thinking that yesterday and last night was going to be kind of the peak of the conflict because it's been 3-4 nights in a row. It's the weekend. The police have had time to organize and decide how they're going to deal with looters and rioters, not protesters, but how they're going to deal with looters and rioters. So I was thinking last night was going to be real conflict based. And what I saw was early in the day, in the daytime, there was tons of signs and there was tons of protesters and true protesters. The signs, the marches, the singing, the dancing, those kind of things was during the day. As it got dark and got into the nighttime, I didn't see people with signs anymore. And then that's where you saw a lot of the people were doing the rioting or the looting, the vandalism and those kind of things. But there was tons of protests. So the narrative that there was only looting and rioting, you look at like San Francisco, or not San Francisco, but Los Angeles, there was an intersection yesterday that had tens of thousands of people out there peacefully protesting. They weren't breaking anything. They weren't burning anything. They weren't attacking any cops. They were out there peacefully protesting. It was a very diverse group. It wasn't all brown or all black. So I hope those images are seen and understood, but go ahead.
Are we breaking? Yeah. I've seen all those visions, and I've seen people protesting here in San Jose and Oakland, and quiet protests in San Francisco. Unless I missed it, I don't. You know what I don't like though? I don't like the block the freeways and the roads. I get you're trying to get people's attention, but man, if I'm laying on the side of the road and I got in a car wreck and I need help, I need the emergency vehicles to be able to get to me. Right.
So when you're blocking traffic, that one is I'm conflicted with those because it is getting people's attention. It's getting news press. It's getting the police there. But if emergency vehicles need to get through, they got to be able to get through.
Yeah.
Trump's tweets are not helping. I look at some of the things that he's done and I try to see both sides of things. I've seen some good things that he's done for the country. But man, it's like he's trying to be inflammatory. Like he's on his phone and he's tweeting things like, you start looting, we start shooting. I think he tweeted, and this probably needs to be verified, but I saw it on CNN, so I'm thinking they wouldn't misquote a tweet. But apparently there were protesters at the White House, thousands of protesters at the White House, and he said that if they would have broke through the line, they would have met nasty dogs or snarling dogs. And all that does is conjure up images of the 50s where there was water hoses and dogs attacking black people, attacking protesters. We've all seen the images, the black and white pictures of protesters being bitten by dogs or being used with the water hoses. So he's not doing any favors or any effort, at least on his Twitter account, to help calm things. It's like he's gas on the fire.
Yeah. Me and Trump don't get along. But so we have Dr. Samoa coming in the second hour, and I just wanted to say that we stand with Black Lives Matter and prayers to the protesters, especially George Floyd's family. So we have ads that we're going to get into. Hot Siva Mena.
Hot Siva. We're switching gears here. Hot Siva is run by our very own Neo Ve'avea. He presents Hot Siva every Monday, Wednesday, and Friday morning at 9 a.m. For those of you that have been following for a while, it used to be at 8 a.m. Now it is at 9 a.m. So follow the Neo Show Facebook page for low-impact stretching and aerobics to PI music. Great music and nice. You're still moving. You're still doing exercises, but it's a low impact. and it's not like I don't know, P90X or some crazy high impact, high speed exercise program. Neo runs it at the right speed.
Yeah. And then Essence of Mana is a free 12-week class designed to support adult family members in developing communication skills and real-life tips that can lead a more loving and nurturing family dynamic. Free for the whole family. Follow Essence of Mana on Facebook for all their updates. Nani and Lulu have been doing Talanoil Tuesday. So go to the Essence of Mana Facebook page. They also have... Journey to Empowerment, that is every first Friday of the month. Next Friday's first Friday of the month, they'll have Journey to Empowerment via Zoom. So stay tuned. We'll be posting information about that. Are we going to the song?
We're going to go to break. Our second song is Sunshine by Leilani Wolfgram. You're listening to the Faika Podcast. Don't go anywhere. When we come back, we will be with Dr. Samoa. Talk to you soon.
You're listening to the Faika Podcast. I am Nackie. With me, as always, is Carl.
Good morning, everybody. We are now in our second hour, and as promised, we chased down our very, very busy doctor. He's going to hate me saying this, but we are extremely lucky to have a leader that is talking in front of Congress and engaging us as community-based organizations and doing so much for our people and our people's health. So we are honored to have Dr. Samoa with us on the phone.
Oh, I'm honored to be asked to be on.
Hi, Dr. Raynald Samoa is a clinical expertise in appetite modulation, diabetes, thyroid, pediatric endocrinology. How about that?
This down, Nackie. Look at you.
Nice.
Good morning, Dr. Samoa. Thank you for your time this morning. We just wanted to talk about well, first of all, you testified this week, and I watched the whole thing on C-SPAN. We actually recorded the whole thing and then edited and just cut your part in, because that's all we care about. But tell us a little bit about that, or a lot about
The experience
and what you spoke about at the
Ways and Means.
Yes, there you go.
So the Ways and Means Committee reached out to me, and in their email they mentioned that Representative Jimmy Gomez, Los Angeles, one of his staff had identified me and referred the Ways and Means Health Subcommittee. Basically they reached out wanting to know more about COVID-19 in Pacific Islander communities, and I think Representative Judy Chu's office also had somewhat of a hand in it as well. And so the purpose of the hearing, so for those of you who don't know, and this would have been me a couple weeks ago, the Ways and Means Committee is one of the congressional committees that decides a lot of where the budget comes from, like where does our tax money go to, and what programs are funded and which ones aren't, Right. So they're a very powerful committee. And people like Carl knows this.
I know. I had to ask him what is that committee?
Yeah, the committee's they're gonna make the budget for things like healthcare, Medicare, Social Security. I mean, they're pointing billions of dollars of funding to programs. So that's what I consider would be the most powerful committee in Congress.
Right, and so I've never addressed Congress before, and so it was an experience for me. And basically what happened was, I don't know if this was an audition, but they interviewed me beforehand, and I guess based on our discussion with them in the beginning, they decided that I should testify at the hearing. And the hearing was to report the disproportionate impact of COVID-19 on communities of color. And so the panel of witnesses that were in the hearing was pretty amazing. You know, this was not sort of the local cable show.
Right.
These were professors and authors, physicians, and heads of different medical systems, and all of them were lending their voice. And so the fact that this little Samoan boy gets to go in front of this powerful committee,
That is crazy amazing.
right, to talk about the plight of our people was extremely humbling. And I have to say there was a little bit of intimidation, but because I think I already told you guys know this from the beginning, because you guys were interviewing me prior to COVID.
Right.
And so we talked then about how I'm not a fan of public speaking.
Right. Yeah, we know. And
Right. But every time I say that, I get, I keep calling. And so maybe this is sort of God or the universe telling me, hey,
yes.
trying to get over that.
Yeah, get used to it.
Right? So the opportunity was there for me to talk about the disproportionate impact and the devastating rates, and I think that's the thing about looking at it from my angle is that, people can sort of close their eyes to when they don't want to see things, and they can focus in on just their neighborhood.
Mm-hmm.
But being the only Pacific endocrinologist on the continent, I don't have that luxury.
Right. Right.
So I have to look at places like Texas and Oklahoma and Arkansas and places that we don't generally think about, Illinois,
Right.
because our people are there and they're getting sick. And Arkansas brings up a good point. There were rumblings that we knew our people were getting sick. Like the
Right.
public health department didn't report their disaggregated data. And so, there were no official reports at the time talking about the rates there. But, literally, as I was on a call, because I was on a call in Oregon. So the Oregon region got together a group, and during their meeting, one of their members had literally just come back, had driven to Arkansas in one day.
Wow.
with her nephews, because her brother just passed away.
Wow.
And they're Marshallese and had to come back, and and it was the sad story of they couldn't be with him. They had to mourn from the parking lot. And they still went down there. Like, they still went down, knowing full well what was going to happen. They drove all the way from the Northwest to Arkansas to do so.
Mm.
And this is before any of the reports came out. So, this prompted the group, our regional group in Arkansas, to poke their public health department and goes, please, start disaggregating data. Or start reporting it. And our own private group started looking at the numbers, and they started to notice the disparity. And so with that, the community group could go to the public health department and say, hey, look, this is happening. But this is the power of our people at work, right?
Right.
While they're waiting for the public health department, they start sending out surveys like needs assessments to see what the people need, during this time, because they're not going to wait
Right.
to hear the numbers are bad. Over 400 Pacific Islanders filled out that survey, and because there's zip code data, they're able to sort of tell people where the testing needs to happen, And so what happens with that testing? Well, the numbers have increased incredibly, but a lot of that is because of the increase in testing.
Right.
One of the things that is the most shaking to me is that last week, when they looked at the data, 40% of the people that had COVID-19 in Arkansas were under the age of 20.
Whoa.
Nobody else has that. Like nobody else is demonstrating that high of a disease prevalence in their youth, you know. And so this is on the backs of the community. So of course, now that the public health department and everybody is like aimed in that direction, who's already armed? The community group,
Right.
Right.
you know, and they got their funding through Tyson because they, you know, a lot of those communities are employed by Tyson. So, you know, the Arkansas group just looked for resources to try to do the work that needs to be done. And so,
And do
you
they
know,
know why? Do they?
well, they're essential workers. You know?
Oh, yeah.
So this idea that Pacific Islanders are a small community and we don't matter. Well, my response to that is we're in rural America now.
Right.
You know? And in rural America, you're starting to see these outbreaks, and they're threatening industries that we say are vital, like our food supply. You know, and so ignoring the outbreaks in our community means that you're threatening that part of our country.
Right.
You know, and that affects all of us. You know, and so that's been my message, is that we all matter, you know, and
Right.
in the light of the recent riots and
Right.
protests, it's sometimes, you know, you don't realize that if you keep telling people they don't matter, bad things happen.
Exactly.
And so that's so I you know, inspired by what they're doing in Arkansas, inspired by what they're doing in NorCal, SoCal, Utah, Oregon, Washington, Hawaii, Arizona. That's what helped me get over, you know, being able to present to the Ways and Means Committee, was that I wasn't going in by myself.
Right.
There is a community of people behind me that I go in with that. You know, and so as long as I stay to that, I never forget who I am.
Yeah, I was so proud that when we turned on the TV and we literally just let it roll. So I just and you know, my husband was like, let us know when Dr. Samoa is on. And of course that was the only reason why we were on there, but we were just so proud just to see a Pacific Islander there representing, like you were speaking for everyone. And if you did not know what a Pacific Islander looked like, there he was on TV.
And I think what was important was you weren't just a PI representing
Right.
and being on there. The information and the way you presented it.
Yes.
It was like the bar wasn't just to be visible. You know what I mean? It was be visible and be very engaged and informative in the way that you were speaking. So it wasn't just having you on the camera, which obviously is the visual effect and the imaging, but the information, the way you conducted yourself as well. It was a proud moment.
Yeah, it was. And
Thanks, Carl.
with California starting to open up, like I know I'm going back to work tomorrow, and it's supposed to be, I don't know what the curve is, flattening or we're on the bend.
Yeah,
Or...
I'll tell you what it feels like, and usually what it feels like is what the media is portraying. What it feels like is the threat is not past, but it's, you know, we're over the hill and we're kind of cruising into getting life back to normal. That's one of the things that I'm concerned about is as we begin to go through different phases, and there's counties, cities, states, all different levels of it. But as we progress back towards being around people and making sure that we're socially distanced and things, it's get this feeling of like, okay, we're going back to normal. And I'm concerned that we just kind of, it's like we've been through it, now we're okay, and we just kind of move back too quickly. And I think that another thing that adds to that is the imagery of the rioting and the protesting is there's tens of thousands of people crammed into, you know, little tiny areas. And I think that is going to amplify the feeling that, okay, we're by it and we can kind of go back to normal. Is that a concern of yours as well, Doctor?
Absolutely, absolutely. And it's different in different places. Like, and mind you, um, you mind, this is my informal Facebook survey.
We all
There's
have
a
one of those.
lot of, right? There's a lot of different reasons why there's different rates in different counties, and so San Francisco County, I can see the argument there. I can see why people think that they're flattening, and because they, and mind you, they have a different population, and they're a lot smaller, and
Right.
there's more nuances to LA County, but that this is where our messages have to be very clear, is that uh, LA County, for all these reasons, have a hard time implementing a lot of the safety measures. And as of yesterday, or shoot, as of today, they had the largest one-day total
Right.
of cases.
Wow.
So it's not flattening. And mind you, yesterday, there were the people that were wearing masks in public was literally way, a small minority.
Right.
Most of the people we saw out were not wearing masks.
Yeah. I noticed that too.
Yeah, it was the reporters, and then there was a few in the crowd, but
Right.
yeah. I
Well,
saw
no,
the same
I'm
thing.
talking about the ones here, like on our street, on our block,
Mm.
and it's and so you see that, and you hear, okay, the churches are opening,
Right.
and I'm like, oh, how are we going to brace against that?
Right. Because there's a lot of elders that are in the churches.
Because there's a lot of pushback against there's a lot of people in our community that are still adhering to, this is a hoax, this isn't real.
Right.
And I'm just happy that they haven't been affected, and so I can ignore the part of them that probably doesn't meet with my reality.
Uh-huh.
But the part that says, okay, at least they're doing okay, is fine. But the other part of it is that I have to figure out, okay, why is it? Why is it somebody's so resistant? And I get it. Like there's a part of fear that you can't control. If you can't control other people, then you should just denounce the fear.
Right. The
And
coping mechanism.
Right, a coping mechanism, and I get it. I fully get it. But part of that, the deconstructing that coping mechanism, is finding messaging that works. It's like, because yelling at them that this is not a hoax and showing them proof,
Yeah.
doesn't work.
Doesn't
Right?
work.
Right.
That's obvious. Yeah.
Right. And so I think what my messaging towards those people and individuals have been is like, it's when you go out and you're putting your family at risk, and if you think they're not going to get it, that's okay. But I'm always going to fight for you.
Right.
I'm always going to try to make sure that if we can protect you from harm,
Mm-hmm.
my job as a servant to our community is to continuously do that. And so you may disagree with me, but know where my intentions are.
Right.
I think that's a good way to deal with, because if it's denial, that's an emotional response. That's not a logical or rational response. And then if you're trying to deal that with logic or rationalization of here's the data, it's not meeting the emotion. And if you can change the emotion to, something that's understandable, family, care, love, those kind of things, and you're probably going to get, the message is going to be received better than showing them a spreadsheet with data.
Right. Right.
Right. Because that's not working.
Right.
That's not working.
No matter how pretty the graphs are,
Right.
you don't respond to it. And so, and I've been blessed to see some movement in those fields, as long as you, because I think the thing that people think is that somehow we profit from this, that somehow our ulterior motive is that we get something out of spreading fear. And I absolutely do not. Like,
Right.
there is diabetes
No.
epidemic that I have to put on hold for this.
Right.
You know, that all the chronic disease work I'm doing, um, I have to set aside for a second, because of this. And so there's no profit in this.
Right.
And so, yeah.
I
Yeah.
hear the medical profession is actually suffering because of, there's elective surgeries, there's there's all kinds of pieces of the medical profession that aren't able to operate right now. So
Right.
people to think that somehow the hospitals and the the medical profession is making money hand over fist on this COVID pandemic, it's like in most instances it's the opposite. Like there's people that aren't able to work because of it in the medical profession.
Oh yeah. Like, I mean, I know people like to think of entities as these stone blocks, and that they have really bad motives. But these hospitals are in trouble. You
Right.
know, they're losing tens of millions per quarter. And even more so in the bigger hospitals. And so this whole notion that somehow hospitals are gauging this pandemic
Mm-hmm.
doesn't fit with reality.
Right.
Doctors are being pressed to do more
Right.
because of the drop in revenue. Like there's not just the stress of like trying to, because now almost all the hospitals now have to deal with COVID. There was a couple weeks ago, many of the specialty hospitals were spared from it, but ours, just like others now, we're all dealing with COVID-19 positive patients because they're not getting it from the hospital, but they're coming in with it. So yeah, it's this. So I harken back down to, okay, so what is your big problem with? So what if the hospitals are profiting of it? Let's go there.
Right.
What is it? How does that impact your decision? Like, what does that mean to you? Is it just like you said? It's if it's not rational,
Right.
then let's not try to use a rational approach to. Let's not try to use reason, but appeal to something that speaks to more an emotional level.
Yep. And that makes sense because you're trying to get, it's not about being right. It's about getting the message across. I can be right and not help you, or I can try to find a way to format a message so it reaches you and it helps you. And then I'm getting what I want. I'm helping you and you're getting, healthy, or you're receiving the message. But I think that's part of the problem with, and I think social media plays into this nowadays,
Right.
is people just more concerned about being right as opposed to, trying to communicate or get their point to be heard. It's just about, posting something that makes me right, and then I can feel good about it.
Yep.
So on a different note, I think we had sent you a message about excited delirium, and I'll throw out there what I'm reading about with the George Floyd murder, and that's what I'll always refer to it as. So they're saying there's a theory out there that excited delirium, he had it, and they were trying to restrain him during a episode of that, and that's why they had removed him from the vehicle and put him onto the ground. There's claims that he said he was claustrophobic, so he didn't want to be in the vehicle, so they accommodated him and removed him from the vehicle. But I'm hearing that term excited delirium thrown around a lot, and I had never heard of it until now, and I figured I got a doctor on the line. Maybe I'll ask him about it, but I don't know if that's anything you've heard of.
Delirium, yes, because delirium is a medical condition. I haven't heard the term excited delirium used in medical circuits before. Like, it's if I saw it as a medical provider, I wouldn't know what it was referring to because it's not a commonly used medical term.
Right.
Now, that being said, there are some, and mind you, that's just because that's not my specialty. But there are references of it in the medical literature, in regards to it being a state of agitation, aggression, and acute distress,
Right.
That can possibly lead to sudden death. So yeah, so I know about it in those terms, but I don't have personal experience with treating anyone with it.
It'll be interesting to see as this case develops what defense or what kind of mitigating factor they're going to try to create. It's just difficult out there because the video's out there and everybody's seen it. So I think that I don't know, but crazier things have happened. I just in my mind yesterday I was thinking through, can you imagine the outrage right now, and if in a year or so or now, whenever the trial gets done, if the verdict comes back something crazy, what the reaction is going to be. But I think from a societal standpoint, the issue is, if not this, then what? Then it's the next one, or it's the one after that. It's like now the tolerance level for something like this from society, like we've shown what the response is going to be. Some of it is good, and some of it is very, very negative. But what are your thoughts on what's going on across the country and the response?
Well, I and Nackie have had a discussion about what my place is in our media, and I have to be very, very careful about
Certainly
getting into political spaces.
Right.
And I mean, like, I'm not afraid to say it, but I use my other formats in my social media to relay those opinions, because that's all they are, is opinions.
Right.
So to save my credibility as a medical expert, I try to stay out of it.
Yeah.
Well, you've got a lot of that, so
Right.
we don't want to chip away at any of that. Just a crazy time.
I attempted to see the video, and I personally couldn't finish it. Like I couldn't watch.
I haven't seen it either. I can't bring myself to watch it. I've heard the stories. I've seen bits and pieces, and really I've just seen, well, most of the video, I believe, is the police officer's knee on his neck, but that alone is just, it's troubling. So I think I will at some point watch it, but I can't bring myself to watch it right now.
I think that's where I stopped.
Yeah.
Right.
Yeah.
I stopped right when I saw like he on his neck, and to me, from a medical standpoint, it's a compromised airway.
Right.
Right.
So that alone keeps me from watching, because I know somebody's at risk.
Right.
Right.
And we know what happens in the end. You know what I mean? So I don't want to watch what happens, because I know that in the end he dies.
Nackie was saying it earlier in the show that there were a lot of positive images that we hope are put out there. There was images of an officer that got separated from his unit and was protected by the protesters. There's images
awesome.
of officers taking a knee, white officers taking a knee with the protesters at an intersection. There's images of, protesters cleaning up the mess. People, that were there that didn't loot and didn't break things and do those kind of things. And they're there with trash bags, cleaning up the mess. So there's a whole bunch of positive imagery out there, and it may not sell really well. It's not, cool headline kind of stuff, but I hope that maybe social media or media, mainstream media itself, picks those kind of things up, because people need to see both, because it can't just be all fire and destruction and looting.
I am concerned though, but my big concern about that too is the gathering and the COVID-19. I have a feeling that it's going to spike back up again. And this week I was in a Zoom meeting where they said that they're close to confident that a second wave is on its way.
Yeah, well, we're still in the first.
Right.
Yeah, the numbers aren't.
Right.
Yeah.
Right.
Everyone keeps saying like, "Oh, when do you think the second wave will happen?"
Yeah.
It has to happen after the first one's done because we're still in it.
Right. We're still in the first wave. And then talking to one of the speakers at this Zoom meeting that I was in, they were saying that every state, like California is starting to open up, but like New York, because the numbers were so crazy and the death rate was so high, that New York will not open as compared to Wyoming will open a little sooner. You know what I mean? But people's concern is that people can still travel to Wyoming. So,
Right.
you know, it's what's stopping that from happening. So I just, hopefully everyone just continues to wear a mask, continues to practice social distancing and wash your hands, and the same precaution that you took when this first happened, you know, like you come home and wipe off your shoes and take your clothes off, that you still can, people, not you, Dr. Samoa, I know you do that, but people continue to do that. You know, I know that listening to some people, they're starting to be a little lax about that, you know. Like,
Yeah, that's the feeling.
that's,
I
yes,
get the
everybody's
feeling
starting to be lax, and
starting to see social media with people
gathering,
doing
and
things they wouldn't have done 2 weeks, 3 weeks, 4 weeks ago.
yeah, that's my worry. And for me, you know, I'm a person where my immune system is compromised, and so I'm just a little weary when I go places, and I wash my hands. But did you know what I mean? So-
Sometimes we need when
We need
we
reminders
make
to
decisions
stay
that we
home,
might
yeah.
do things. We need an expert to get on the line and go, no, that's not a good idea.
yeah.
Thank you, Dr. Samoa.
Yes. Carl and I were thinking of going to a test site to promote it and to get people to come
Listen
to
to
the
him laugh
test
at us.
site. Right. And so then we go, Carl said, I'm all, let's go. I can't wait. And then Carl goes, should we ask Dr. Samoa if we should go because our immune systems are compromised? And I go, oh, okay, we'll ask him. And he was like, I usually don't give advice. What did you say, Dr. Samoa?
He said, I remember exactly. He said, I'm not the one to tell people that they can't do something, and there was like a pause. And we had just thanked him for being so direct and to the point on the conference calls. And he was real direct and to the point. You can't do this.
Yeah. Oh, oopsie.
Yeah.
It was a reality check.
Right. And so, like your concern is one I have too, because like I said, there's different rates. And
Right.
so our families live in counties near each other
Mm-hmm.
that have very wide rates.
Right.
So, you can take the risk of that county and then move it into another county when you keep visiting each other.
Right.
And my family, oh my goodness, like
All across
I
the
know other
world.
families are struggling because they're still struggling with it,
Right.
and I constantly have to be like, I love them.
Yes.
That doesn't mean that, when I say that it's not a good idea to get together,
I know.
I don't love them.
You're right.
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 It probably means I love them enough to say, don't visit each other.
Right.
Right.
And again, it goes back to our culture, where we gather for everything. And when we greet each other with a hug and a kiss,
Yeah.
and we always, and to the
So
elder,
you enter a
especially-
room, you go,
Yes.
you greet everybody. You go greet
greet
everybody in the room.
Exactly. Especially if you're a youngster, when you come into a room, you have to address every adult in the room. So our culture just makes it very hard to, something that you've been taught since you were born. You have to retell, to tell them not to hug or not to kiss or not to gather. It is really hard to get
Absolutely.
to sink it into their mind. Can you just do this for a couple of months so that we can, that we can survive the rest of our lives? But it's so hard. And I know I'm guilty of that too.
Oh yeah, I've had people ask me, it's like, hey, do you think it's a good idea for us to visit our auntie in the nursing home? I'm like, oh no,
No,
no.
no. Those are where most of the highest numbers come
Yeah.
from,
Yeah.
nursing homes.
Oh, like in both ways. Like, if you expose them or they expose you,
Right.
you know, you got two high risk groups, like increasing the risk of exposure.
Exactly.
Like, maybe we wait, you
Yes.
know, and so
Maybe we wait. And can we? Yes, we can. Yes, we can
yeah.
wait. Yes, we can. Yes, we can. Just it's the whole culture thing. I think that is really driving the numbers high because that
Yeah.
that's what we do as Pacific Islanders. We get together. I mean,
We celebrate.
We celebrate.
Yeah.
We hug. We kiss, and it's
So part of my job is to know when the limitations are with that, and we know that there's limitations. So as these churches open and they some of them will congregate,
right.
we have to do our due diligence and make sure, like if they have symptoms, we have to try to get them tested
Yep.
and keep this idea that just because we disagree doesn't mean we don't show up for each other.
Right, right. And even I know that they've let some churches, or did they let the churches congregate already? Because if they
Yeah,
did,
I think that there's
yeah,
they have to limit like 25% of capacity or something.
Yeah.
It depends by county, I think, but they're limiting it's not just open back up and do things the same way.
There's and I know that a lot of churches have kept their doors closed because they want to be safe. They want to be 100% safe before they open their doors back up. So that I'm grateful to hear. I've heard a handful of Pacific Islander churches that are not opening up because they want to be safe. So that's awesome to hear.
Well, and then that's really awesome. But man, are there some that are foaming at the mouth?
Woo, okay.
Oh.
I know. On the other hand, there are some churches that have already started to gather, and I'm hoping that they're, seating people, at least in different pews, and everybody's wearing a mask, and maybe somebody should stand at the door and take people's temperatures. I'm not sure. I worry because mostly elders, a lot of elders go to church. So that's my main concern. Everybody, but the elders, and if you have some kind of pre-existing illness, you're at a high risk to catch COVID-19 and to possibly die from it. Dr. Samoa? Right.
Right. And so I think our showing up for them is to make sure that the lines of communication stay open.
Right.
Like, and so they're not, you gave them the advice, choose to do otherwise, but keep the lines open.
Yes.
Because, and say, hey, okay, I'm not going to judge you, but can we do these things to help you and your community stay safe? Like help if someone has some symptoms, what's the community plan? Like, what's the safety plan?
Right.
We know what to do in the case of a fire. Same thing.
Exactly.
If you have symptoms, how do you keep the family that has symptoms? How do you keep them from getting the stigma and being afraid to being tested? You need the trusted reliance on the church to help gain access to these people. So that they can be tested and they can formulate, like I said, a safety plan so that they can get their family tested. They can get the appropriate quarantine facilities and any kind of social support. There's a couple like food distribution things going on in all the regions.
Yes.
And, and we just need a better way of connecting people that need it to these resources. And so this, I too, like you, worry about them, but I have to put that worry aside and say, okay, what's our next step? Like, what are we going to do if this happens? And so, it doesn't allow me to sit in those spaces for long,
Yeah.
Right.
And so it keeps me up at night.
Yeah.
And so, My family's like, go to sleep.
Yeah, I appreciate the work that you're doing, Dr. Samoa, and you're in every single committee that I've gone to.
I know,
Every
you're
Zoom
so
meeting that
busy.
I go to, you're there. You're a speaker. It's because everybody trusts you.
Yeah.
And I can't say this enough that we did a focus smoking group, and we did 3 groups, and every single group that it was for Pacific Islanders, every single group said they trust CBOs that are led by Pacific Islanders, and it's crazy, but we need to see people that look like us. And I think that's why so many people trust you. Pacific Islanders trust you because they're seeing someone like them give the information.
I think it means something to get advice and information and guidance
Right.
from somebody who understands what you and your culture and your family and your everyday kind of life looks like. Versus, and another person may. So if a, Hispanic person or a white person gave advice, maybe they do, but that's not really the feeling that they get. I would think that Hispanic people want to hear from people that look like them.
Right.
And the same with the PIs. And we definitely heard that loud and clear in our focus groups.
Right.
All 3 focus groups said if they were going to get help for smoking and services for stop smoking programs or education awareness, they wanted to hear from the church or they wanted to hear from a CBO. And we discussed having resources and those kind of things. And they're like, no, we want to hear from you guys as a community-based organization or another PI CBO or the church. And that was
big.
That was the end of the conversation for them.
Every 3 meetings, everyone said the same thing. So it's important for people to see someone like them giving the information. And unfortunately, that's how we work. You know what I mean? So I'm grateful, and I'm so happy that you are, you're the person that's giving the information, the correct information. And, and so you're on all kinds of committees and all kinds of just trying to help get the information out. I think that's what we're all trying to do is get the information out, get the right information out, and to let you know how it's an emergency for Pacific Islanders to pay attention. These people are not gathering just for the heck of it. We're trying to save your life. Basically, we want to save your life. We don't want you to go to the hospital because you have COVID-19 and your family can't visit you.
Right.
Yeah.
Heartbreaking stories.
Heartbreaking.
Dropping people off at the ER and never seeing them again.
Yeah. That you don't want that to happen. You do not want that to happen. So, Dr. Samoa, we're so grateful for you.
You're a busy man. Thank you very much for the time.
I'm grateful for what you guys do too, and so, your leadership has been amazing. Every time I've asked of you, the question wasn't whether we can do it or not. It was like when and where.
Yeah.
What time. And I'm finding that out. Like anybody who joins in, our work is so huge, and it touches almost every aspect. So, anybody, absolutely anybody that wants to get involved, there is a place.
Exactly.
Great point.
And so, I'm not saying it's perfect. We still have generational issues.
Right.
You young people need to listen, and the whole I want to do it our way. But all of that needs to happen for us to build and grow capacity.
Right.
And so the worst thing about the pandemic for people is thinking that they're helpless, that there's nothing they can do. And so I'm here to tell you with 100% certainty that there is always something you can do.
Always. And there's resources for you. If you are home sick and you can't get to work because of COVID-19, there are resources. If you need food, if you need help paying your rent, tons and tons and tons of resources. You just have to reach out, or we can try to help you find, what you need, or try to help that
Yeah.
that you're totally not alone. You're not alone in this. So that's important for everyone to know. Dr. Samoa, we appreciate your time. I know you're at work and you took time for us to take our call. I appreciate you so much, and I'm so grateful. And thank you for all the work that you're doing.
Yeah, thank you, Doctor.
Thank you.
Have a great day, Dr. Samoa. We love you. Thank you.
Love you. All right.
He's awesome.
It's a busy man right there.
He's very busy man.
When we're on calls with him, he is jumping off one call at 7 p.m. to get on another call, to get on another call.
Yeah. And we're on those Zoom calls, so it shows where you're at if your video is up. And it's like, I don't know, a call that we're on for like from 7 p.m. to 9 p.m. Dr. Samoa is Zooming. You can see his office behind him. So he hasn't even made it home at 9 p.m. because he's busy with these Zoom calls and trying to get, everyone information about COVID-19 and everything that is important. So thank you, Dr. Samoa, for your time.
We're lucky to have him.
We are so lucky.
Before we go any further, because we usually do this at the end of the show, I wanted to thank Mena for her production efforts. I got here this morning. She was working on the show. She's putting it together. And when we finally get into our own studio, the drop in the production quality. Soon the viewer will appreciate what we had while we were in the Moley dining room. So thank you, Mena.
People will be like, what
happened to all the graphics and
yeah. I just wanted to say good morning to Malamala, Sentry David Fatawi.
Good
morning, brother. Tammy, thank you for tuning in. All of you, thank you for tuning in this morning. Dr. Samoa, Raynald Samoa, gives a lot of great information. He's on Facebook and Instagram, and don't bombard him with all your ill questions.
No, you get in our way of us doing it.
Yes, yeah, you'll get in the way of our questions, but we appreciate Dr. Samoa. He does a great job at the City of Hope. And he is one of a kind.
Yeah,
literally one of a kind.
I meant that when I said we're lucky as a people and as a community to have him as our spokesperson and working for the betterment of all of us. We're lucky.
Yeah, we're lucky. So thank you again. Fangongo Samoa is presented by Samoan Solutions. It's a play written by Sia Figuel, produced and adapted by Samoan Solutions, Epi and Fanga. Happening July 10th and 11th. Show details will be announced soon, so follow Samoan Solutions on social media outlets. Made possible by the generosity of San Bruno Community Foundation. If you haven't followed them, they have loads and loads of information on Samoan Solutions Instagram and Facebook page. They have Shop Pacifica, where you can go and shop Pacific Islander items, and we have a t-shirt. We have Phil Alapati, Feel Good Cuts. His shirt, we could see Carl's better. I have a blue one on, but Carl doesn't have a big old laptop blocking him. It's on. Phil Alapati, Feel Good Cuts. The barbers haven't been working, and so support. He has t-shirts on sale. Support. Also, Big Body Radio. Cisco Lutu is now on Twitch, so follow him there. He kept getting cut off on Facebook and Instagram, so he's now on Twitch.
I saw a 200 bumper sticker on the way in your house today.
Oh, yeah. 200, go to HUNNIT. Go follow them. They sell clothing. So follow him on Instagram. He's a Bay Area kid, and he's not a kid. He's a Bay Area young man who is taking it upon himself to, he's created this company, him and some of his friends. Go shop Pacifica. I think since I've been home, I've been doing a lot of Pacifica shopping, and so I get packages arrive daily that Mo doesn't know about. So let's keep that on the down low. Let's keep that on the down low. But
Mamalu Designs.
Mamalu Designs, graphic designer. She does flyers, posters, T-shirts, sweatshirts. Get a hold of Mamalu Designs on Instagram, which is our Epi Almavai. She does a great job. She does our flyers and lots of other stuff. So thank you, Epi. Who else do we have?
Mena.
We have Mena, who also does our flyers. She does our Pacifica Telenol flyer. Did I miss anybody? So Journey to Empowerment is next Friday. We will post the Zoom link for Journey to Empowerment, which is a safe space, safe place where they talk about taboo topics. That is led by Asian American Recovery Services. So go follow them, Essence of Mana. Who else? Oh, Fearless Wayfinder. Go follow
Jordan Fihaki.
Jordan Fihaki, Fearless the Wayfinder. He's on Instagram. He sells clothing. T-shirt. We have T-shirts. I've got a beanie. He has this jackets and hats. Go follow him. I have a sticker on my thingy-majiggy, my laptop.
Word to the wise, if when we open up and you see his booth at one of the events, don't wait to buy it, because when we were at the Turkey Trot last year,
Right.
a whole bunch of people went by the booth and said, oh, I'm going to grab that later, but they didn't want to carry the shirt around with
Right.
them, so they went back to the booth later in the event, sold out.
Yeah,
So drop
sold
in there,
out.
you see something you want, pick it up.
Yeah, and especially when you see the Wayfinder, they also have a scholarship with Professor Lassie and Drew Vai. So please go support Pacifica, shop Pacifica before you decide to go elsewhere.
And today is the 31st, so it's the last day of Mental Health and Awareness Pacific Islander Month. So hopefully we all participated in that and are intentional, not just this month, but always be intentional in the way that you take care of yourself.
Yeah, so we are done. Any
good.
last hoo-has?
No.
Also the last day for Pacific Islander Heritage Month. So
We celebrate that every
we
Sunday.
celebrate that every day. So go check out our page. Go follow our YouTube page. We're starting to upload our shows. Please download the Faika podcast app. We're going to be uploading all our season 1, season 2, and season 3 when we were at FCC Free Radio.
You don't have to listen to season 1.
Yeah, season
Because-
1. No, well, we had really good guests, but like our first couple of shows, we were like brand new. We sucked, but that's okay. So YouTube and download our Faika app where you can find us on everything. SoundCloud, Apple, Spotify. Right. And right
iTunes.
here at Facebook. I wanted to wish my sister TT, it's her birthday.
Oh,
Happy
she and my
birthday,
mom share a
sister.
birthday.
May 31st. Happy birthday, sister. God bless you.
Happy birthday to you.
And happy birthday.
Happy birthday, Mom.
Yes. Happy
Love you.
birthday, Auntie Dot. Thank you for tuning into the FICA podcast. Please follow us on all social media outlets. Tune in every Sunday from 10 a.m. to 12 noon. Special thank you to Dr. Samoa and Mighty Mena. We're right here on Facebook Live, or download the FICA app, like I've said a million times. Have a great week, and we'll check in with you next Sunday. Come back to FICA with us.
It's a cold world, but I'm gon' shine through. They told me keep my head up, well I've been trying to. They say that I'm gon' do it big, well I've been dying to. I wish I got that same love from the ones that lied to. Cause it's a cold world, but I'm gon' shine through. They told me keep my head up, well I've been